Assessment of the eyes.
Hi, good morning. My name is Kels Janarmisi Kaime, and today I will be assessing the eyes, which is an important organ for our sense of sight. So, in our pre-introductory phase, the first thing we need to do is to review the previous medical records of our client. This is to have an initial data regarding the patient that we are going to assess. Next is to know the scope of the assessment and also prepare the necessary equipments. This is important too because we have to know the limitations of the assessment that we are going to do, and by preparing the necessary equipments will make us as an efficient nurse. Okay, so the materials that we are going to have or use are a pen light. Next is a Snellen chart. Then gloves if necessary. Okay, and lastly a pen and a jot down notebook. And then after that, we had to perform hand washing and also don gloves if it's necessary. This is to prevent any spreading of microorganisms which will cause any diseases during the assessment. So now we are going to greet the client politely, introduce ourselves, verify the client's identity, and ask how the client would like to be called. This is to gain trust and full cooperation during the assessment. So hi ma'am, good morning. My name is Kels Janarmisi Kaime, your student nurse for today. And may I see your wristband please? Can you state your complete name, ma'am?
Rose Grace Cordero.
And your birthday please?
October 1, 2001.
Okay, so ma'am, how would you like to be called?
Rose.
Okay, so ma'am Rose. Now we have to explain the procedure that we are going to do and tell the patient or the client how she can participate during the assessment, and also provide opportunity to raise any concern. This is to know if the client understands the situation and doesn't have any clarification to be clarified. Okay, so ma'am, today I will be assessing your eyes, and I may need you to stand up or sit down and may ask you to about something regarding your eyes. Is that alright?
Yes, ma'am.
Okay, so do you have any concerns, ma'am? None? Okay, so now next is we have to provide comfort, privacy, and confidentiality. This is to prevent any embarrassment during the procedure or the assessment. So now I will be closing the door to provide privacy and adjust the temperature and the lighting of the room to provide comfort. So mom, is the temperature okay?
Yes, ma'am.
Okay. So now let's begin. So ma'am, if I may ask, do you use any graded glasses or contact lenses? Okay, so kindly please stand up and then be positioned in 20 feet away from the Snellen chart. So what you are going to do, mom, is you have to use this to cover first your right eye and then read what's in the Snellen chart. You have to read first the biggest letter until the smallest letter that you can read. Then after that, you have to put this in your left eye and then read it again. And then after your left eye is your both eye. Okay? So now please make sure that your right eye is covered. Okay, so please read now.
E F P T O Z L P E D P E C F T E D F C Z P F E L O P Z D F F O T E C.
Okay. So in your left eye, please.
E F P T O Z L P E D P E C F D E D F C Z P F E L O P Z D D E F P O T E C L E F O D Z C T.
Okay. With your both eye, ma'am, please.
E F P T O Z L P E T P E C F D E D F C Z P F E L O P Z D D E F P O T E C L E F O D F C T.
Okay. Okay, so you can now sit, ma'am. And then, mom, what I am going to do is you have to tell me how many fingers I am showing you, okay? What is this?
1,
This?
2,
This one.
4,
And this one?
5.
Okay, so next is you have to tell me what direction I am pointing my finger is, okay? This?
Upward,
This one?
right,
Okay, and this one?
down.
Okay, and then can you see the light, ma'am?
Yes,
And this one?
yes,
What side?
left side.
Okay. And this one?
Yes,
Okay. Okay, now, so mom, what I am going to do is you have to look at me in the eyes and I will be wiggling my fingers in the side of your ears and you have to tell me okay if you spotted already my fingers entering your visual field. All right? Okay.
okay, 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 okay.
Okay. So mom, you have trouble. I observed that you have trouble in your right eye and now I'm going to do it again in your right eye. Okay?
Okay. 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 Okay.
Okay now, and I also have or need to do it in your other side of your eye. Okay?
Okay. 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 Okay.
Okay. So now let's proceed to the next one. Okay now, so mom, I will be inspecting your eyes. Now your eyes are aligned and symmetrical. Your eyebrows are evenly distributed. And also it is slightly arched. And can you do this one? And this one? Okay. Your eyelashes are slightly curled upward and it is evenly distributed. Can you close your your eyes now? Okay. Your lids are symmetrical. No discoloration. Okay, you can open now your eyes now. Okay, so now I will be palpating for your lacrimal glands and lacrimal sac. Okay? So, okay. No swelling, no edema, and no tearing of lacrimal ducts, which is normal. Now I will be checking for your iris and pupil. It's normal. And now for your cornea and lenses for opacities. Okay, it's normal. Okay, so now ma'am, I will be using pen light to check for your consensual and direct reflex. But first, let me darken the room. Okay. So, ma'am, what I did is I shone light in your left eye first to see if it will constrict, and it constricted, which is the direct reflex. And next is the consensual reflex. The consensual reflex is when I shone light in your left eye, your right eye should constrict also, so that is the consensual reflex. Okay? Okay. So proceeding to the assessing of your accommodation, what you are going to do is kindly focus in the tip of my pen light, okay? And then look at the wall at my back, okay? So look at the tip of my pen light. And then at the back, and then at the tip, and then at the back. Okay, so focus here. Okay, okay, it's normal. So now, ma'am, I will be performing the Hirschberg test to inspect for your cornea, okay? Just focus in the light. Okay. Okay, so your eye, when I shone a light in your one eye, it constricted, and also the other one constricted, even though it was not shown by a light. Okay, so it's normal, ma'am. And then, okay, so now, ma'am, I will be performing the cardinal fields of gaze test. So I will be standing 2 feet away from you. And then what you are going to do is you have to focus in my pen light and do not use or move your neck or your face, just your eyes, okay? And let's start. So now, ma'am, I will be testing for your convergence, and you only have to focus at the pen light as I move it towards your nose, okay? Okay, it's normal, Ma'am Rose. Good. Alright. Okay, now, ma'am, I will be summarizing the information I have gathered during the assessment. And in your visual acuity in your right eye is 20/20. Your left eye is 20/15. And your both eye is 20/15, which is normal. And in your visual field, which we did earlier, the wiggling fingers, your visual field in your upward is 50 degrees, in your downward is 70 degrees, and nasal field is 50 degrees, and it is normal. Okay, so in your eyes, I have observed that it is aligned and symmetrical. Your eyebrows are evenly distributed and it is slightly arched. And your eyelashes are slightly curled upward and not inward, okay? And eyelids are intact, the skin is intact. And your blinking is normal. It is 15 blinks per minute, okay? So in your lacrimal gland is normal, no swelling, no edema, okay? And your sclera is also normal. It's white and normal. Palpebral conjunctiva is normal also, which is good. Your iris and pupil are normal, no opacities. Your pupil is 3 millimeters and it's good. In the accommodation which I did to you earlier to focus in the object, and then at my back, it's your pupil reaction is normal. In the cardinal field gaze test is that both eyes are coordinated, no jerky movements or anything, and everything is normal, ma'am, and it's very good. My only advice for you is to minimize your exposure to any gadgets. Consume more vitamin A rich food, which is very good for your eyes, and also rest after spending too much time with your gadgets. Okay? Okay. Do you have any questions, ma'am?
None.
Okay. So we're done. Thank you very much, ma'am. Thank you for your cooperation. God bless. Thank you, ma'am.
Thank you.